Next, I would like to welcome Mr. Gnanasekaran. Gnanasekaran is a healthcare management professional with 18 years of broad-based experience in eye health management, led eye hospitals in different locations in southern and northern India and in Nigeria. And he currently heads the business development of Sankara Eye Foundation, India. Please.
Thanks, Katie. Good afternoon, all. So I'm here to present about our experience in use of the artificial intelligence and in collecting the patient feedback, both from the outpatient setting as well as the inpatient setting. So this we are calling it as SAHAI. It's a Sangra Health through Artificial Intelligence. SAHAI in Hindi, it means assistance or help to someone. So we have named it like that. So this model is we can able to recognize 10 of the Indic languages across all the locations we have presence in India. And we have started collecting the data through this AI-based voice recognition system in the month of July last year. And we are using this model across 14 locations of our hospitals across India. So if you look at, there are three components as part of this feedback collection mechanism. The first part is the collection of data or the feedback from the patient. So we have a web-based portal through which our patient care executives collect the audio response from the patients, both from the OPD setup as well as from the IPD setup. Then it goes to the portal called the Here at AI's application, which actually grade as well as transcribe the audio into the text messages. It also assesses the sentiment of the patient, whether it is a positive or a negative sentiment, or it is a neutral sentiment. And based on that, it automatically raises the ticket. Say, for example, if the patient is giving a negative comment about a different aspect, where it could be related to the waiting time, or it could be related to the cleanliness of the facility, or it could be related to the process delay or the communication of the staff. So it rates that, it automatically raises the ticket. It goes to the another application, integrated application called Fresh Service, where the concerned heads of the units as well as the facilitator, they get the intimation that there is a complaint or the negative ticket has been received. So the process is like I mentioned earlier. So we are capturing the feedback, and then we also the AI automatically transcribe into the text messages, and also it analyzes, and it also raises creates the sentiments and raises the tickets, and it also suggests what could be done. So not just to creating into positive or negative or neutral. For the negative sentiment, it also suggested what could be done based on the earlier information it has received from the previous responses across different locations. So it is a kind of ongoing system. It's an evolving system. And based on all the feedback received across all our 14 locations in different parameters, it automatically ranks our locations and which are in different parameters. So each unit branches of Shankara is been rated based in different metrics on different rankings. So as a people who are, we are at the headquarters, as well as the people who are heading the individual units, they can able to know like where they are exactly to focus, which are the pain points in their units. And as a higher level, central level, we also know which are the units we need to give more focus. So that intelligence also it is giving to us. So just to put just information about the data aspect. So it is, we have this data we are presenting here. It's about 8 months data between the August 2024 to March 2025. So the locations, 14 locations across 10 states. The total number of feedbacks we have collected is about 1.72 lakhs feedback we have collected, including both OP and IP. So we have a criteria across all our centers where we, in a day, we collect about 25% of the outpatient, we collect feedback, and also about 95% of the IP, we collect feedback. This we set as a criteria across all the locations. So in an average in a month, we collect about 20,000 plus feedback. So we are feeding all those information to the system and priming and tuning the system into an effective one. So based on the feedback we received during this 8-month period, so the total positive feedback we have received is about 99.03%, and the negative feedback is about 0.97%. And the tickets which raised by the AA in the system, negative tickets, it's about 1,678. Yes, and each of those negative tasks have been reviewed at the individual unit level, and they have to do the root cause analysis. They also feed it to that fresh service portal that what the action they have taken. So that also we also analyze at the central level. So that's the whole system is all about. If you look at the challenges like any other all the other data collection challenges, collecting the feedback from the patient is the main thing, and especially a specialty setting where they would have waited for about 4.5 hours, and then you are going and asking them, many won't be ready to give that feedback, and some of them are not ready to give a feedback, with voice feedback. They say, you give me a paper, I can put a tick mark and give it to you, and don't ask me to ask for audio response. So that is one thing. And sometime in the initial period, the AA, also the classification of the sentiment, also we had some issues. So some of the neutral also it's rated as negative. So that we need to manually, we have to validate and feed back to the system to prime it. So that was there. And setting up the accountability and also the orienting the team about the importance of this, as well as closing those negative tickets on time was the initial challenge we had. So the lessons learned, like if you enable the patients to share their feedback in a conveniently, rather than the traditional method of giving a questionnaire and other things, to talk in their own language. So that actually makes them more empowered to share whatever they feel. That was the main learning point we had. So though there is 1% negative we have received, but that 1% negative feedback has helped us in looking at, relook at most of our systems to improve our efficiency. Yeah, thank you. And I thanks the whole team, my team, who helped us in setting up system. And it's also an ongoing system. Yeah, thank you.
Any questions? Okay.
Yeah, I mean, you partially answered that, but what was the false positive or false negative sort of thing that you got?
So
Was the person in was it quantitated?
So the false positive in terms of the understanding what the patient said. Say, for example, even in the Karnataka is a state, I take as an example, we have two branches. One is in Bangalore, one is in Shimoga. The way the dialect they speak in Shimoga is different than Karnataka. So though the patient has spoken positively about the services we have offered, but the word he used, the AA has termed it as a negative. So that and all we have tried to change it. Thank you. Thank you.